So I think I've met most of you, but I'm Sarah Holmes, physio for the adult service. So just thinking about activity, following on from the diet, I don't have any exciting quizzes, but we've got a bit of pilates, post-lunch pilates. So I think throughout the day, you'll have heard about modifiable factors, so things that you can influence or control that may help manage your symptoms. So we've just heard about food triggers, and you're all experts after those quizzes. Temperature, I think Deepa mentioned earlier on. I'm going to focus on exercise and rest and thinking of ways to find that optimum balance for you. But there's also things, so within my work and the nurses' work, that we can support with, so letters for your workplace or in the paediatric service for school, thinking about reasonable adjustments if your environment at work isn't helping. So important considerations. Graded exercise is really important. That's what I hear overwhelmingly from people living with channel conditions. And building up to a consistent level where your muscles are used to doing what they're doing. If you do a lot less or a lot more, it's likely that symptoms will be aggravated in some way, whether that's triggering episodes of weakness or more myotonia. Cooling down after exercise can be important as well, and that can also help your muscles to prepare and kind of transition in and out of the exercise and into the rest afterwards. And stretching, as for anyone, can be important as well. So lots of people I work with describe having good and bad days, and maybe on a good day they might do loads and loads. That would be a boom day on this graph. But following that, because that's above and beyond what their muscles are used to, it might be that symptoms are aggravated, that things are worse and they need to have a prolonged rest. The problems with that are you lose a bit of control in terms of like planning what you do day to day, but also all the benefits of exercise that you'll have gained from that good day, that active day, will be lost if you have to be in bed for days afterwards. So we tend to try and help individuals think about ways to build that consistency to avoid those spikes and drops in activity. The other problem, as I kind of alluded to there, is if you have extended periods of inactivity, your muscles can often become deconditioned. Muscles and your heart and your lungs as well. So if you have, for whatever reason, lost opportunity to exercise and to keep active, your muscles will be weaker. That can lead to increased fatigue and can introduce an additional barrier to staying active. Your heart and your lungs might not be functioning optimally, so your stamina might be affected, but also you can get pain and weakness just associated with this deconditioning, this loss of activity. Can have reduced energy, and in turn this becomes harder and harder to keep active. So this is one of the things we try and focus on to enable individuals to develop strategies to kind of overcome and to build activity and movement into their day. So graded activity, as I'd mentioned, thinking about a stepwise approach to gradually building up over weeks and months. That can often be effective. And some top tips for people living with these conditions are little and often is good. Avoiding prolonged periods of inactivity can also be helpful. And thinking about activity not in terms of exercise necessarily, but just moving. Interrupting periods where you're sitting for half an hour or more, including household chores, getting washed and dressed as part of that activity. Planning rests and focusing on what feels comfortable is always a good tip. So if you start to feel like you're pushing, it's becoming really hard or effortful, maybe have a break and come back to it later and think about building up gradually. And as I'd mentioned, you're aiming for that consistency, so a similar amount of exercise over the week, every day of the week. That's the long-term goal. And there's some information on this and other elements of energy conservation or fatigue management, which go hand in hand with that activity on the Muscular Dystrophy UK website. Exercise snacks is something, it might sound a bit weird. I'm not encouraging eating here, but bear with me. I think during COVID, a few colleagues and a patient actually had coined this term exercise snacks or snack-a-size. So where you might snack throughout the day, perhaps you could think about exercise and moving in those terms. And actually, having heard colleagues talking about it, my colleague Geeta Ramtari in particular, I now see that a few personal trainers and Stanford have started to focus on this as a term. So any movement, not necessarily related to going to the gym, could be thought of as exercise snacking. And I think for people with channel conditions, that idea of going to the gym and exercising is often not a positive one. You think, lots of people have told me they think of people in lycra pushing, and that's either going to aggravate your myotonia or trigger weakness, so that's not that helpful an idea. But thinking of just moving around, standing up, stretching, it's all helps and it's all beneficial. And I think finding something that works for you in your routine and that you can continue with comfortably is the most important. There's also, for people that walk regularly, there's a nice app on available through Public Health England. It's called Active 10. So this is an option if you want to think about having slightly faster walks, working on your aerobic fitness, your cardiovascular health. The app gives you a reminder to have a 10-minute, slightly faster walk every day. And once you've got that consistently, there's an option to add a second, slightly faster 10-minute walk every day. And actually walking a bit faster so that you're taking slightly deeper breaths, but can comfortably talk in a full sentence, is helping with your cardiovascular fitness, your aerobic fitness. That's helping with your heart and your lungs, and that's something that we definitely recommend if that's a level that you're at. So that's a nice app. I've had some good feedback on. But enough of my talking about slides. I wonder if you can we'll just do a couple of quick exercises. So if you can all sit up and maybe wiggle your bottoms back to the back of the chair and feel that support of the backrest. Make sure you're comfortable, relax your arms down, and I'll just talk through a few tips I'd like you to follow along. Don't worry if you've never done Pilates, we'll just do a bit of an introduction, but for those who are familiar, a recap here. So if you think about the crown of your head. Imagine you've got a string attached and that string's being stretched up to the ceiling, so you might feel a bit of length through the back of your neck. If you tuck your chin very slightly, just a degree or two, you might also feel a bit of a softening around the back of your neck and around the front of your shoulders. And now bring your attention to your shoulder blades on the back. If you can feel the contact with your shoulder blades and the top of the chair, I want you to imagine and visualise your shoulder blades melting down towards your back pockets. So again, you might feel a lengthening and a softening around the front. Now the challenge, I want you to hold that position as you take a nice, slow, deep breath in. And as you breathe out, I want you to bring your tummy button just in towards your spine very slightly. So you might start to feel a bit of tension in your lower tummy there. Keep that tension, breathe in again, breathe out again, and then relax. So for those that could feel a little tension in their lower tummies, they are your core muscles, and they are some of the muscles that are most important with Pilates. If it wasn't so easy to feel that tension there, what you could do is think about imagining you have a belt with 10 holes, and as you draw your tummy in, I want you to imagine tightening the belt to the second hole out of 10. You can also focus on flattening the curve in your lower back towards the chair. So whichever of those images work best for you, we'll try that again, and then we'll add a bit of leg movement this time. So stretching up through the crown of your head, chin down very slightly, shoulder blades melting. Nice slow deep breath in. Breathe out, engage those lower tummy muscles, flattening your back. Keep that tension as you breathe in again. Breathe out. And now I want you to slide your right foot just a centimetre forward, keeping that tension in your tummy, keeping that set up, so chin down, shoulder blades down. Breathe in again, slide your foot back. Breathe out and relax. How was that? Did everyone feel a bit of activity? That's a gentle introduction to Pilates. So we have 4 different videos on our website. I think people have mentioned them already. Had some colleagues said that they're going to have a go. So there's a standing, sitting, lying on your tummy and lying on your back exercise videos. They all have an introduction, but they're not set up like a class. So they're just individual exercises you can watch, see if there's any that you fancy, and then you can follow along. But this is featured on the sitting one. I hope that's helpful.